All right, I'll introduce our next speaker. Dr. Dusty Oedekoven comes to us from the National Pork Board, where Dusty serves now as the Chief Veterinary Officer for the National Pork Board and has been very engaged in a new strategy that the Pork Board just is starting with in 2025. It's the National Swine Health Strategy Initiative. And Dusty is going to inform us and get us up to speed a little bit about what's happening with the Pork Board and that new initiative. So please help me in welcoming Dr. Dusty Oedekoven.
All right. Thanks, Tom. All right, good afternoon, everyone. Thanks for being here. After lunch symposium, and you had a lot of other options. So thanks for being here. Hopefully, this is not the first you've heard of the National Swine Health Strategy. But if it is, that's okay. We'll give a brief overview of what that is and how it's where it's come from. And if you've been engaged in the process, this will be an update on where we're at in the process. So thanks to Ann and Mike on the update on U.S. SHIP. And I think it's a good place really to start and maybe introduce where we're going with the National Swine Health Strategy. So several years ago, after the emergence of African swine fever virus moving across China and Eastern Europe, some of the leaders within the U.S. pork industry got together and said, we need to establish what are the industry priorities for ASF preparedness. There was a lot of work going on by USDA, by academia, by the state animal health agencies and others. And so the industry leaders got together and said, what can we be doing? What are the things that we need to be working on? And those industry leaders put together through a process of collaboration, these are very abbreviated, the 6 industry priorities for ASF preparedness. But you'll see that one of those is U.S. Swine Health Improvement Plan, and really the codification and transfer of that program from a pilot program to be managed by USDA as an official program. So I give you that context as, why are we doing something now with swine health at a broader level? In some ways, developing priorities for ASF was relatively straightforward. It's a disease we didn't have. We wanted to keep it out, but we wanted to focus on the things that could really make a difference here. Providing tools for farmers for on-farm preparedness, for example. Providing tabletop and functional exercises to walk producers and their state animal health agencies through scenarios that would help put them in the mindset of what it takes to respond to a foreign animal disease. Working with our NPPC partners and staff in seeking clarity on indemnification should we get an outbreak of ASF. So those are some of the things that we worked on. Recognizing that this work is really never done. There's always ongoing work for foreign animal disease preparedness, but we still are looking ahead to going, well, gosh, what have we been talking about here for a day and a half, right? There's endemic disease concerns, progress being made, for example, here in Minnesota on mycoplasma, suggestions coming out of U.S. SHIP as to what other site status verification programs could be going on. And the list goes on and on. There's a lot of work being done for swine health. But at the Pork Industry Forum last March, the delegates to the Pork Industry Forum passed an advisement asking for the development of a national swine health strategy. And what is that? We'll look at that in just a little bit. But that was also included and came out of a new strategic plan that the National Pork Board passed in April of this year, listing swine health as one of the 3 pillars within the strategic plan, and specifically asking for the development of a national swine health strategy. Again, we looked at that ASF prioritization as a model and said, well, there's a pathway forward for gathering producer input, establishing priorities, and then working together as an industry to achieve our goals. So really what we're trying to do here is gather producer input. One of the things that the advisement said very clearly is this needs to be a producer-led initiative. We need to understand the producers' perspectives on what are the most important swine health challenges and how should we go about addressing those. Secondly, we're gathering as much of the industry expertise as we can around these issues. We've got an advisory group formed that I'll talk about here in a little bit. And through the process of gathering that information and informing that advisory group, we aim to come out of, actually in about 2 or 3 weeks here, a list of strategic swine health priorities. From that list of priorities, and these are really, again, I'll use the term at a strategic level, decisions that we need to make for the industry to say, we're going to move in this direction, okay? And as an example, U.S. ship, codification of U.S. ship. There are a number of tactics that we've been working on to get that process done, but the overarching strategy is getting that program up and running and getting it codified. So those are the kind of things that we're going to be looking for to come out of this strategy. After the strategic priorities are established, we'll be working to establish some tangible, collaborative, actionable items. We had some really good comments earlier today from Dr. Luke Minion about collaboration. A quote that I heard Dr. Christine Manquist-Wiggum talk about: innovation doesn't happen in isolation. Those all resonated with me quite a lot as I think about where we're going with this National Swine Health Strategy. It's an industry-wide collaboration, okay? So we've been working hard to gather input and insights from the industry. We've been doing that in a number of ways. We designed a survey to collect information from industry participants, asking them about their biggest swine health challenges and what to do about them. We also gathered some demographic information here too, so we could understand who we were hearing from. For example, production systems, or show pig producers, or independent producers versus integrated producers. We had several one-on-one conversations, and maybe I got to talk with some of you during those conversations. We held listening sessions. How many of you, this is audience participation late in the afternoon, how many of you got to be part of a listening session? All right, at least one, couple of you. All right, Jill, I know you were in more than one. So yeah, we had listening sessions across the country where we heard from groups of people. Here in Minnesota from the Minnesota Pork Producers Council, sometimes from production systems, from veterinary groups, a number of different groups that we sat down with and said, tell us what your challenges are. And then working directly with those state associations to understand what is important in each state. So I hope I don't disappoint you. I'm not going to reveal the top things we heard from the group because we're trying to protect that a little bit for our advisor group that's going to meet in 2 weeks. But I will tell you who we heard from and just kind of a little bit about who we heard from on these surveys. So 822 total survey responses, and 68% of those directly from producers, with the remainder being from veterinarians and allied industry groups. You can see that, and one of the things we asked them was, how many sows do you own, to try to get an idea who are we talking to. You see the majority of respondents do not own sows, okay, but the majority of respondents market 80,000 or more pigs per year. So I guess you can kind of see who we were hearing from there. But notice that, for example, we had 117 responses from producers who had less than 50 sows. So quite a range in there from the different groups that we heard from. I think a pretty good representation across all different sizes and scope of operation there. We had 47 listening sessions, and we heard from producers in 36 states. And again, maybe I didn't mention, but we kicked this off during World Pork Expo during the first week of June, and then we closed our information gathering on September 1st. We had a few sneak in kind of late. Patrick and I made a trip to North Carolina last week to get some perspective from the East Coast there. But of these 564 producer responses, you can see quite a variety there. A majority from, 37% from independent producers, with additional responses from integrated producer packers, the show pig community. We had a pretty good response from the show pig community. They communicate with each other very well. So you tell them you're looking for a survey, it just goes out through a network, and we got a number of responses there. The other category would be like genetic companies and some of our other allied industry groups. So this advisor group that will meet here in a couple of weeks to consider all of the data and the information that we collected is comprised of 12 producer leaders, and we've tried to select leaders who are geographically diverse and also diverse within the scope of the industry that they represent. So we have show pig producer leaders on there. We have integrated production producers in there. Producers who have served on the U.S. ship GCC, and some who serve on the SHIC the SHIC Board of Directors. We've got some who serve on the MPPC Board of Directors and some who serve on MPB and others who are just completely independent. And we've tried to hit all geographies across the country, tried to kind of balance that out so we get a lot of different perspective in there. We also have the state execs from Indiana and Missouri serving on this task or advisory group. The two CEOs, and for those of you that may not have heard, I'm sure everybody's heard, but David Newman is our new CEO at the National Pork Board, so he'll be filling in that role, and then Brian Humphreys from MPPC, and then Dr. Anna Forsyth and myself will serve on this advisory group as well. And so again, their task really is to review all of the information that we've gathered and consider what priorities we should be working towards. And then we will provide that to our boards of directors. A little bit of a busy slide here, but this is a timeline. As I mentioned, we kicked off that information gathering in June, closed it in September 1st, and so we are trying to collate and gather that data in a way that we can give it to the advisory group here in a week or two, and then we'll meet with them first week in October. Once that advisory group meets and develops that strategy, we'll be presenting that to our boards of directors in November, as well as sharing with the state pork producer associations and trying to solicit some feedback on those priorities to make sure that we're directionally correct and start to develop the actionable plans that will help us to meet those goals. So some of those could be within the purview of our national organizations, NPB or MPPC. Some of those may be things that we say, this is something that we need to hand off to our academic institutions or to our federal government agencies, or to suggestions to the biopharma industry on things that, tools that we may be lacking, or potentially to feed into a program like US SHIP. So those are the kind of things that we can foresee maybe coming out of those as tangible, actionable, collaborative items, okay? Our goal is then to take this back into a progress update to the attendees at the National Pork Forum in March. And from there, I think that will really help guide where we go in the future with whatever efforts that come out of that advisory group. So last fall, we did a producer survey. The Pork Board did a producer survey asking, what are the most important aspects to the success of our industry? And 98% of the respondents said that swine health is important to the success of the industry. That's one of the things that's led us on this journey. And as you can see, we've come through the information gathering phase and are now in the process of developing those strategies. And with the ultimate goal that aligns, this is the language of the strategic initiative in the Pork Board's strategic plan, is to improve the lives of our pigs and our people. This is my team at the National Pork Board. I'm especially proud of them for all the work that they put in over the summer. And not included in the picture, but equally important, Dr. Forsyth with NPPC has really helped pull the wagon on this work as well. So feel free to reach out to any of us at any time if you have questions about where we're going with this project or any other things related to swine health. Also, I don't know if any of you can hit that QR code from where you're at, but we do have a swine health bulletin, and that's where you can subscribe and be part of an information thread that we have and sharing information and updates about this effort and others that are related to swine health from the industry perspective. So with that, is this a good time for questions, Tom, or are we going to wait till?
I think we've got just a few minutes here now for Dusty to ask him just any questions that you have in regards to the initiative that he's presented to us with background information today. So we've got a mic out here for you got one available to. Yeah. So if there's any questions, raise your hand. I got one to start with, Dusty, and that's, whenever we do something like this, an initiative in the industry, the question seems to be always comes down to how are we going to measure it?
Yeah.
So like what are the KPIs? What's that going to look like? I know it's really early in the process, but could you just address that a little bit about what that could look like?
Yeah, I think yet to be determined, but I can tell you the process that we used with the ASF priorities, and that was as we had weekly meetings between the different industry staff groups that were involved, and I'll include MPPC, Pork Board, SHIC, AASV, as we met to consider what is our piece in this and how are we measuring success. We use just a simple stoplight KPI metric. You know, our key indicators are measured by, are we on track? Green, you know, are we running into problems here, yellow, or are we just really bogged down in red? And that would help us to prioritize and measure where we're at. But you know, we developed a process that we were able to just continually ensure that we were on track with these type of things. And I think it was during one of those meetings where we realized, hey, we've come a long ways on this. We probably need to expand our scope on this a little bit, because we've been working on ASF priorities for a long time. And so this is an opportunity to really go, well, we know there's other problems out there in the industry. How can we help? But really understand where the industry needs that help.
Thanks, Dustin. I guess I'm still a little bit confused about what all will be included. I know you
Yeah.
can't share, right?
Well,
Which
no,
you're
it's a
killing
great-
us by not telling us anything, first of all. But yeah, are we talking about, like, is it just health and disease, or is this going to be encompassing a lot of different information? Is it biosecurity? Is it, I mean, there's so many things that I can imagine in here, I guess.
Yeah.
Is there a scope to it, to how big it is, or how small it is, I
Yeah,
guess?
that's a great question, Sarah. And one of the slides I didn't put up here, but it was one that I've used. No, I didn't really cover that. You know, one of the opening slides we have is there's so much going on in the way of swine health. I mean, just look at the agenda for this conference, right? There's a lot of good work going on by a lot of smart people and a lot of, well-intentioned work, right? And yet still, you know, there's needs, right? And we just sitting in the MHIO presentations and Dr. Peters' list, here's my wish list, right? And so, we can't work on everything, and we really need to get, I think, focused on, what should we be working on now? Some of those will be infectious disease things. I mean, we heard, and I think I'll just share in general things that we heard during the listening sessions, because I don't think it'll surprise anybody. Many of you sat through some of those. So we heard things about infectious disease. It may come as a surprise, but the biggest thing we heard about was PRRS, all right? Probably not anybody's surprise, right? And we've had a lot of, there's another session going on right now on PRRS, and we had yesterday morning on PRRS. So, PRRS is the biggest thing, right? So that was not a surprise that we're going to hear about PRRS. And we heard about many of the other endemic diseases, which are of concern to the industry too. But we also heard things, for example, from the show pig sector pretty loudly that, hey, we don't have access to veterinary services. We would like to have more information about basic protocols, and I've learned a lot about the show pig industry. It is a big force, okay? And I think I don't know if this has actually been quantified, but it's been said, if you added them all up, they'd be like the 7th largest production system in the U.S., and they move like crazy, right? So they have some needs in the way of swine health. So we're listening to that as well. There's other issues too that may be genetic issues, or sow mortality is a huge issue. So we've heard all those things and more. What maybe. Even though we could probably list, we could probably just quickly list the top 6 issues right here, and we'd hit it pretty good with what we heard. Where there was a little bit more variety is, what should we do about it? And that's where some really good suggestions came in, and I think where we're really going to start to see, where does the industry want to go with these type of things, and how can we align our work to go in the direction that the industry generally thinks that we should go. So, that could be research. Could be, policy and advocacy for our NPPC partners. So there's a variety of outlets for whatever the need is. But so it was not restricted to just bugs and drugs, but and we did hear kind of the gamut of issues related to swine health outcomes.
So just one follow-up. So your goal is to define, let's say, your goal is to define 5 or 6 topics, let's say, and then is the same committee that you're participating on, and are you guys putting together the strategy for each of them, or will that dive into?
Yeah, so the advisory group is really just a point in time. They're going to react to that information that we put together. And I mean, we've like I mentioned, we've tried to pick industry leaders who we feel confident will give us, a good direction, good strategic direction. I would say the final approval, so then their work is done. They're really just going to provide the advice and the direction. Then it'll be the work of the staff of our national organization. So Dr. Forsyth and myself will lead that work. And in some cases, it may be that we don't have all the information that we need yet. And so I think some of that we're going to have to call an audible on how we lead the direction of where we're going. But ultimately, it will be our boards of directors at the National Pork Producers Council and National Pork Board that kind of give the approval to go ahead with, calling this the plan, the strategy that goes forward.
Because developing the plan might include, you're saying, bringing in some people with expertise in certain, let's say it's mycoplasma, you're going to need mycoplasma experts to help you. I mean, depending on what the topic is and what you're trying to accomplish, right?
Yeah, and I'll go back and give you an example from the ASF priorities. This first one, harmonize, the full title is Harmonize State and Federal Response Plans. And as a former state veterinarian, I looked at that one and I went, well, good luck, because there's a lot of opinions on how we should, respond to things. But in general, there are response plans already established. And so one of our first, even though that was the strategy, to harmonize the state federal response plans, one of the things that we did was form a working group of state, federal, and industry participants to review the current response plans, provide feedback, and eventually that led to adoption of changes that better aligned with the industry's needs. So again, I don't know what the priorities will be, but I think that's an example of a strategy to help prepare the industry, and then what are the things that we do to align with that strategy.
Very good, thanks.
Yep.
We got time for one more question, anybody? Yeah, Monsi.
First, Dusty, congratulations to you and your team to actually do this. And it feels very exciting to me. That goes back to having more of this more inclusive agenda, kind of. My question is, one of your points you referred to, you would like to see the groups to collaborate more. I forgot what the Venn diagram really had. And more tangible, collaborative, and so on. In particular, on the collaboration side of things, how do you see National Pork Board involving others with the university, producers? How do you see that coming together?
Yeah, excellent question, Monsi. So what does collaboration look like? And again, I couldn't have said it better than Dr. Minion this morning, talking about collaboration and really the need for the whole industry to get behind this. That's what this is, even though you see the Pork Checkoff logo down here, and it's our team and Dr. Forsyth and her team leading kind of the development of this strategy. It really is an industry-wide strategy. Beyond, our national organizations are leading it because we represent the producers, right? But it's going to take veterinarians. So we're going to be working with AASV. We've got to establish the Swine Health Information Center. We'll be collaborating with them in the way that makes sense for whatever issue comes out of the priorities. I think certainly universities, the research community, I got to imagine there's going to be researchable questions that we're going to have, that we're going to need to have answered to lead to achieving the goal of whatever the strategy is. So it's an exciting opportunity, I think, for us to reassess, again, the priorities. At the simplest level, all this is kind of like Patrick Webb, who's going to be here with the Pork Board 20 years next month, all right? And he sometimes is our keeper of all things historical and institutional knowledge, and he says, well, we're not really going to hear anything new. And I said, well, maybe not, Patrick, but this is a chance to get what's the current issue? What's the priorities of things we should do? And for example, I think you could go, well, it's PRRS, right? Okay, but what about PRRS? What about PRRS is the thing that we're going to focus on? Because just saying, well, we're just going to identify some money in the budget for PRRS research doesn't quite get us to answer the questions that producers have. So we're really trying to dial in what is it that we need to move forward with. And again, I think this is a snapshot in time. We're going to move towards that. I think we're going to need to repeat this process with some regular interval. We've kind of set for ourselves a 3-year time frame initially to say we need something to work on for these next 3 years. But I think it gives us an opportunity to look further into the future too about how we are intentional with our work. Because I think when we all collaborate, and to your question, when we really collaborate, I think we achieve our goals for the industry. I love the discussion yesterday on PERS. Some of the work that was being presented yesterday that Dr. Benfield and those guys worked on, I was an undergraduate student at SDSU spraying down the pens for those notobiotic sows, and I thought, well, I was around for some of that, and some of the discussion was, and we're not really making any progress, right? We've made a lot of progress. There's things that have been done, but we need to focus on, well, what are we missing, and how do we get there? So I think collaboration is going to be the key.
All right.
Thank you.
Please help me in thanking Dusty.